Ladies and gentlemen, good morning and welcome to our 9th DiaBeat webinar. Now, I am speaking to you from India, but my colleagues from the RAC Hospital are coming to you from the UAE. Our topic today is diabetes and foot care. Now, who would have ever wondered that maintaining good foot care was important? Things like washing your feet, of course, moisturizing your feet if necessary, wearing socks, buying good shoes. Who would have ever thought that these things were important? But they are. They are, especially if, by chance, you have a tingling sensation in your feet. You perhaps cannot feel, or your foot tends to be a little numb, or perhaps your wounds in the feet heal slowly. And this is especially relevant if you have diabetes. With diabetes, these little factors become vitally important. I mean, when I was reading up on the subject, I read about what is referred to and what Dr. Abhay Khadke will refer to as peripheral artery disease. I read about it in passing, which refers to poor circulation of blood in the foot and lack of feeling. Now, these can have devastating consequences, and I will leave our eminent speaker to talk about this. Now, I was looking at Dr. Abhay's profile last evening, and I had a great sense of deja vu. I noticed that Dr. Abhay has worked with several hospitals, including Apollo Victor, Manipal, Aster, and now in RAC Hospital. And the deja vu comes from the fact that I have been associated over the years with each one of these great institutions. So to that extent, Dr. Abhay and I share a common platform. However, this is not about me. This is about Dr. Abhay Khadke. Dr. Abhay did his MBBS, of course, and thereafter his MS in general surgery from the BJ Medical College in Pune. He is a member of the Royal College of Surgeons in England and a member of the Association of Surgeons in India. He has 17 years of experience, 17 years of experience, not only in general surgery, but also and more so in minimal surgeries. Laparoscopic surgeries. And what is interesting is Dr. Abhay's statement that what is most important to him is the well-being of his patients. And that is excellent. Ladies and gentlemen, an interesting subject. Remember, 1 in 5 of us who have diabetes are very likely to suffer from foot issues. And as Dr. Abhay will tell you, the results of this can be devastating. Ladies and gentlemen, I leave you with our eminent speaker, Dr. Abhay Khadke.
Thank you, sir. Thank you so much for very elaborate welcome. and I'm so thankful for you for your kind words. And let us begin without any further ado. Sharing the screen for diabetic foot disease. I won't be very, I won't be going into much details. I'll stay true to very basics of diabetic foot disease. It's a very interesting subject and a very debilitating for the patient with diabetes, actually. So let us see what we have. Now, it's a most serious complication of diabetes. Diabetes affects every inch and bit of your body. It's a very, very debilitating disease. Especially diabetic foot is a major suffering and financial cost to the patient. So places considerable burden on patient family, healthcare professional, because it doesn't get better. It doesn't get better with time. It goes worse and worse, worse and worse. What causes it? Like as Sir said, like, there are two aspects of it. The one is diabetic neuropathy. Neuropathy is disease of the nerves. Diabetes, in layman's terms, it will cause reduced sensation and the trauma goes unnoticed. So severe cold, boiling hot water, patients don't feel that, and that trauma goes unnoticed and turns into infection and foot disease and further. Plus diabetic peripheral vascular disease, as I said, like the diabetes will cause plaques in your blood vessels, like you get heart disease. Similarly, the peripheral vascular, the blood supply, the arteries will get blocked because of diabetes. Reduced blood supply, the wounds won't heal. So these are the main causes of diabetic foot disease. Now, how to prevent? Sorry. Now, how to prevent it? Prevention is always better than cure. Diabetic foot or ulcer, once it is there, it is difficult to treat. So all the attempts should be made to prevent its occurrence. How do we prevent it? Let us see. First of all, we have to identify at-risk foot. All diabetic patients should be able to identify the at-risk foot. All the healthcare providers should be able to identify at-risk foot in case of diabetic patients. Regular inspection and examination. Education of the family, patient, and healthcare professionals. Appropriate footwear and treating risk factors for ulceration. These are the main factors for ulcer prevention. Cutting nails, simple thing. Don't cut it, circular. Cut it across, straight. Once you go into this edge of the nail, you can introduce infection and that can create a lot of problems. So cut nails straight. Foot inspection. Daily foot inspection is very important for diabetics. Check for temperature, check for blisters, check for scratches, ulcers, check in between toes. So I will be repeating this sentence that diabetic patients should inspect their foot and take care of their foot more than they take care of their face. Now, simple things. Avoid walking barefoot, whether at home or outside. Do not wear shoes that are too tight or have rough edges or uneven seams. Inspect all shoes before you put them on. Wear socks or stockings without seams. Do not wear tight or knee-high socks. Wash feet daily. Temperature should be below 37 degrees. Do not use any kind of heater or hot water bottle to warm feet. Do not use chemical agents or plasters to remove corn or calluses. Use emollients, lubricate dry skin, but not in toes. Again, cut toenails straight across. footwear. The inside length of the shoe should be 1 to 2 centimeter longer than their foot and should not be either too tight or too loose. Now, this is for healthcare professionals. Remove dead skin, protect blisters, drain them, appropriately treat ingrown or thickened nails. Antifungal treatment for fungal infections, very important. I'll end it. Treat your foot better than you treat your face if you are diabetic. Thank you so much.
Doc, if you can add some cases, then it will be very easy for the people to understand.
I'm very sorry. It was a little short prepared. That's why I couldn't get any.
No worries.
But eventually we'll be on this platform again, and we'll like to share some cases and photos, those things. But I just wanted to be very brief in case. I mean, it is just a short take-home message that diabetic patients should take care of their foot more than they take care of their face.
Yeah, Professor, you can take it over. Then I can take few questions if there are. I have few questions on my WhatsApp. Prof, unmute yourself.
Thanks, Dr. W, for telling me to unmute myself. Most often in the office, you mute me. So I'm kind of used to that. But that's said in jest. Okay. Since we have a little time on our hands, I thought I would ask a few questions of my own, taking from what Dr. Abhay has mentioned. First of all, most of us have been told often that we should walk bare feet. And it is commonly understood in Indian tradition that you should walk perhaps bare feet on the grass and things like that. So Dr. Abhay, of course, has indicated that walking bare feet is probably not the best idea. Perhaps you mean when you are diabetic, Dr. Abhay, or does your advice hold at all times? Preferably do not walk without shoes.
No, especially you are diabetic, sir. Especially you are diabetic because the sensation is reduced and trauma gets unnoticed. Otherwise, there are lots of my friends, and colleagues who prefer to run barefoot. They're marathon runners. They prefer running barefoot. So running barefoot is not a problem unless and until you are diabetic. Especially if you're diabetic, trauma is not unnoticed and you tend to get hurt, tend to neglect the injuries and this.
Okay, good. I really don't have anything further to ask. Dr. W, do you have any questions from your panel?
Yes, Doc, I have. I think two participants are sitting together and they have asked the same question. Okay, first I will take one question. Is diabetic foot and diabetic gangrene the same thing?
Diabetic foot is a general terminology which will range from reduced sensation to wounds, ulcers to gangrene. Gangrene is a terminal entity where blood supplies has ceased to exist and the part of the limb becomes totally dead. So that is the end of the spectrum in diabetic foot. But diabetic foot per se is a general terminology which will cover from simple ulcers to gangrene. So diabetic foot per se is not synonymous with gangrene.
Yeah, true. Mr. Alam has asked, this is out of context for a diabetic topic, how to reverse fatty liver?
That's a lifestyle question.
Dr. W, what are your thoughts on that, sir?
Definitely, like Dr. Abhay has mentioned, it's a completely lifestyle thing, and you have to be very religiously following a strict diet and avoiding saturated fat and other things, using more of roughage, avoiding fast food and commercial food. Give your liver a healthy diet so that it can, because liver is an organ which directly indirectly interfere with all the metabolism processes in the body. So you have to be, there is no medication as such. Definitely if there is any other issue connected to fatty liver, then the medication will play a role. Otherwise diet is the most important thing. So I will take next question. Mr. Satish has asked, is surgical management for diabetic ulcer effective? Will it come again? Like you were mentioning about diabetic gangrene.
The diabetic surgery, I mean, surgical management as such for diabetic foot is a multidisciplinary treatment. It involves care of internal medicine specialists, diabetologist, endocrinologist, general surgeon as and when required, plastic surgery, vascular surgery, and intervention radiologist. So altogether, it's a team approach. So basically, it depends on how bad is the infection, how bad is the blood supply affected, how deep is the ulcer, are the bones involved, are the joints involved. So it's not like one stop solution where treatable or not treatable. It's an ongoing disease and ongoing treatment. So end point would be healing of the ulcer, but that end point many times may or may not be achieved, uh, unfortunately. So it's a battle between the disease and the team of doctors. Basically, it's not one man solution. Yeah.
True. And even after post surgery, the follow up must be done properly.
Yes. Yes.
Now,
Yes.
next question is also connected. When Dr. Madhurima is asking, when does it become absolutely necessary to amputate toe or gangrene?
Very good
When it
question,
becomes
actually.
to, yeah.
Yeah. Very good question, but frankly speaking, there is no definite answer. Basically, it all depends on how the blood supplies. The primary thing is blood supply. Where may it be the major blood vessels which are affected, or the microvascular disease in diabetes, which is also prevalent. So basically, once there are two types of gangrenes in diabetes. One is wet gangrene, where we see is dead tissue plus infection, and second is dry gangrene, where only the blood supply is affected, but there is no infection. So dry gangrene, the decision is pretty straightforward. When we see a line of demarcation and there is no blood supply to it, and we cannot restore it, we have to do the amputation of the toe or foot or whatever necessary.
True.
In wet
True.
gangrene, things are little challenging because you don't know where the end point is. Up to amputation will suffice or so it's a clinical decision taken on the basis of like how the patient is doing, how much is the infection, how much it has spread, whether we can restore the blood supply or not. So again, it's a case-to-case scenario. No absolute answer to that.
Yeah, true. And that's the reason post surgical follow up is must.
Yes, yes.
And yeah, connected to this question, because during this challenge, when we were having the challenge starting last month, so there was one patient, diabetic patient, and she had a corn on her right foot, and she started because it was painful, so she started scraping it with the blade every time, and it became infected. And fortunately, unfortunately, you can see she has to land up in the hospital, and the patient came to RAC hospital itself, and she was done surgery to remove the corn, and there was so much of ulceration around that also, because it got infected. It took long time to heal. So, Abhay, you were mentioning about cutting
Self
toenails also
treatment.
straight.
Yeah.
Yes.
Self treatment should be avoided at all costs. Especially if
Yeah.
you're diabetic, don't mess up with your feet. Seek opinion with your doctor, with your trusted physician or surgeon or whomever you trust, go to the doctor. Don't treat yourself at home. Don't tinker with your feet. No, not at all. You can do
True.
makeup
All
for your face, but not your feet.
Yeah. And all the individual depends from differ from each other. So
Yes.
it's best to take a consultation from the doctor. I will take another question. Sarfraj has asked, how does a bariatric surgery help? Because this was every time in the weight loss challenge, bariatric surgery was coming up.
100%,
And as
100%,
you are
100%,
her,
100% in type 2 diabetics. It helps gastric bypass especially. Now it has been, if I am not mistaken, it has been accepted as a treatment for diabetes in what do you call it? This American Association for Diabetes or something. They
yeah,
have accepted.
ED has
Yeah.
also suggested for this uncontrolled diabetes
So
with
uncontrolled
BMI more
diabetes
than
with
40.
BMI more than 35, 40, definitely. It's a
Yeah,
treatment. It's a valid treatment. Yes, but
yeah,
again, it is case to case. It's not a blanket treatment.
yeah, true. Uh, I will take one more question. Just as you were mentioning about various things, like Professor also mentioned about benefits of walking barefoot in the grass, and in diabetic, it's very risky because you may injure your sole, and it may lead to infection and other things also. Uh, in a takeaway message, you have briefly given very point-to-point things. But in three points, if I ask you what will be your suggestion for a diabetic patients in perspective of a surgery,
In
what they
perspective
should
of
be doing?
surgery, no, same thing. I will reiterate. Take care of it. Inspect the feet daily. Moisturize your feet. Wash them properly. Appropriate footwear, and consult your doctor immediately if you have any doubt, any redness, any rash, any small crack, any callus, any callosity, anything. Consult your doctor. Don't treat yourself. That's the long and short of it.
Yeah, true.
Doc,
Yes, sir.
go ahead, Dr. W. Anything else? Otherwise, I'll
No.
ask you.
I was just going over to you only.
Okay. Dr. Abhay, a few thoughts. As you know, a foot massage, and I'm talking about prior to diabetes or in the early stage of diabetes, where you do not have any foot disease in a manner of speaking. So, would a foot massage once or twice a week be helpful in foot health?
Yeah, I mean, yeah, why not? Why not? No harm.
Well done. Thank you.
Thank you.
That's good advice. That's very good advice. The other thing I was thinking about, Doc, is when we I'm not talking about a situation where you already have an ulcer or you already have foot disease. I'm talking about a situation prior to that. You're early diabetic, maybe 1 or 2 years or 3 years, or even more than that, but your blood sugar levels are comfortably around 6.50, whatever, and you do not have foot disease, and you are a frequent exerciser. You wear good socks, you wear good running shoes. I am wondering if exercise, by virtue of it manifests itself in good breathing, it manifests itself in good physical activity, blood circulation. I wonder, would exercise per se, walking, swimming, jogging, and all these other activities that improve circulation, would they be helpful in keeping your foot healthy?
100%, sir. 100%. Not only for diabetic, for everybody. Yes, of course.
Excellent.
Of course.
Excellent. Now I have one question, which may somewhat contradict what you have said earlier. In your opening sentence, sir, you mentioned that ulcerated foot, or the foot with an ulcer, it doesn't always get better. So my question to you here, sir, is this. In the early stages, and I'm not talking late stages at all, I'm talking in the early stages, when one notices that one has perhaps an ulcer or perhaps an injury, but you are diabetic. I mean, you've been diabetic for many years, and you have this injury for whatever reason. And it's not a serious injury. It's an injury that under normal circumstances, first aid would help. What, in your thought, is the ratio of healing for primary small injuries on the foot for diabetics?
No, sir. I'm sorry if I've quoted myself wrong, but I was talking more in terms of diabetic with neuropathy and vasculopathy. Basically, the small injuries is as good as any healthy person. In absence of neuropathy or vasculopathy, it will heal as good as any other person in a well-controlled diabetic patient. So that's not I misquoted myself, because that's not the case. Well-controlled diabetic with no vasculopathy, neuropathy, wounds will heal as good as any other normal human being.
Good. Dr. Abhay, in your opinion, you may have given a very simple lecture, and you may have, in your words, touched upon it in a manner of prevention rather than the high-level surgeries, etc., that you perform. But I can tell you this, and I can tell you this as an active participant in our webinars, that we tend to hang onto every word that our doctor tells us. And each word that you say gives us a lot more clarity in areas in which we have anxiety. Now, I have frequently thought about a foot massage, and I really didn't know the value of that. And you have made me understand that not only will it give me a lot of pleasure in getting a foot massage, but it will also be very helpful. So that's important advice. You also mentioned to me that exercise was a relevant factor in overall health as well as in diabetes. So I have to tell you that whatever you've said has been very important, and I would like to thank you for that. So, Dr. Abhay, on part of the participants, on behalf of my audience, on behalf of Dr. Wilco and the rest of us, I would like to say thank you. But I have noticed that there is one quick question that has come up from Dr. Madhurima. Dr. W, I think the question is, what about vitamins and supplements? Now, I know that is an answer that is more in the lifestyle field. If Dr. Abhay would like to give us a quick answer, well and good. If you would like a lifestyle professional to do that,
no, it is better to be left with lifestyle professional. I'm very inadequately posed.
Okay. Doc, I will ask one question. Yes, sir. Doc, Abhay, you were mentioning about trimming the toenails straight. So, are you making any sense of ingrowing nails? Because it's very common and it becomes fall-ons and ulceration of the toenails.
Oh, no, if they go in the corners, they tend to injure and toes end up getting infected. So always better to cut straight.
Yeah. So anyhow, even the patients are not diabetic, ingrowing nails are very problematic. It infects nail bed. Okay. It's okay, fine. Professor, over to you.
Okay. Dr. Madhurima's asked a question about supplements and vitamins in the area of foot care. You know, I tend to see the big picture rather than, as far as, in my opinion, if one has diabetes, well, then I'm quite sure that you will be turning to your doctor for medicines and other such support. You will also, of course, be turning to your nutritionist and exercise specialist. As regards exercise, Dr. Abhay has already mentioned the vast values of benefit of exercise in diabetic foot or pre-diabetic foot. The question over here is, does vitamins, minerals, supplements, and antioxidants have, can they be beneficial in the healing of diabetic foot or in the healing of wounds? And my answer to that question is a most positive yes. I do know, of course, that Dr. Wilku is more of a specialist in micronutrients than I am, but I can tell you, broadly speaking, that a balanced diet contains all the vitamins, minerals, antioxidants that you require. So if you have a balanced diet, and in particular, if you have fruit and vegetables, you will find that your diet is almost complete to help you with a good healing process. But in addition to that, when you are taking diabetic medicine, I am quite sure that your doctor is already prescribing you with multivitamins and multiminerals. So that as a supplement would about be my answer. To the answer to your question, from my point of view, Dr. Madhurima, would be a balanced diet is excellent. A specific emphasis on natural, raw, uncooked vegetables and fruits would be emphasized from my perspective. An additional supplement, mineral, vitamin, and antioxidant in the pill form given by your doctor would be strongly advised. These things put together would be an excellent support system in case you have an ulcer. But of course, medical management is perhaps the most important. Yes, sir. Dr. W,
I
anything
will
from
just
your
add.
side?
Yeah, I will just add
please.
to it. So you have already covered, but as you said, the doctors are already prescribing multivitamins, and specifically for diabetic patients, those who have neuropathy, they are being prescribed with minerals like chromium, magnesium, rich food, which actually helps to improve the conduction of the nerves. And same time, vitamin B6 is also being given. It improves the blood circulation as well as the conduction of the nerves also. And it's very important. These three things are very important for a diabetic patient, especially with the neuropathy. Otherwise, complete multivitamins is a good source being prescribed.
Thank you, Dr. Abdu. Thank you so much. And if anyone wants more information on micronutrients, please go back a few webinars to Dr. Wilku's talk on alternative therapies for diabetic care. Once again, thank you, Dr. Abhay, for your talk. Thank you so much. I would like to also thank Dr. Wilku for not only for his questions, for his multiple answers also. I'd like to thank my back-end team, IT, RAC Hospitals, Arabian Wellness, for putting up this webinar. And most of all, my dear audience, I would like to thank you also very much. Now, next week, we have another webinar, and we have webinars every week. Our next week webinar is going to be addressed by another eminent doctor, Dr. Ravi Andrews. And Dr. Ravi will not be talking about diabetes and foot care as indicated in this particular slide. He will be talking about diabetes and renal health. Please note that. Dr. Ravi Andrews is an eminent nephrologist from Apollo Hospitals. He will be talking about diabetes and renal health. So to that extent, ladies and gentlemen, thank you so much. And I'll see you again next week. Thank you and good day.